Okay, well, thank you so much, everyone, for joining us tonight. This is the next part of the ONTPD TECaN Virtual Job Search Series. We're going to be talking about contract negotiations. My name is Nicole Locke. I'm the current TECaN Education Chair who just started this fall, so I thank everybody for being here. We are recording this session, so if you're watching it on YouTube, thank you so much. We have lots of other videos on the ONTPD YouTube channel, so please feel free to check those out. And thank you to everybody who submitted questions ahead of time. If you're listening in live, please feel free to ask any questions in the chat. I'm happy to introduce our moderator for today. This is Sarah Mineta. She's from Philadelphia, Pennsylvania, and she did her residency at Rainbow Babies. She's currently a second-year fellow at the University of Virginia and one of just the most fabulous people I know. So please take it away, Sarah.
Hi, guys. Good evening. Thanks, Nicole. I have the pleasure of introducing our two guest speakers that will be going through the didactics portion and answering some of our questions, who are both really prominent figures in the ONTPD. We have Dr. Bonachea, who grew up in Miami, Florida, did her residency, fellowship, and currently practices at Nation One Children's in Columbus, Ohio, where she is the director of the Neonatology Fellowship, as well as the director for the Fellowship Education Program for all of pediatrics. We also have Dr. Reber, grew up in Cincinnati, Ohio, and did a lot of her training there. She did residency and fellowship training out of Nationwide as well. Currently practices at Baylor College of Medicine out of Houston, where she is chief of neonatology. So thank you guys so much. And I think you do have some slides that you were hoping to share. So you can feel free to share your screen whenever.
Sure will. Just give me a second so that I can share the screen and still be able to see the chat.
Sure.
Got a little tiny view of my daughter there. All right, these videos out of the way. Looks good. Okay, so I'll be able to take a little peek at the chat. So if anything comes up. So what I thought we could do with our time here is to do a bit of a didactic overview that will hit some of the highlights of things that are going to be in job contracts, just to make sure as you've gone through this job search series, you have a sense of what is going to be coming back to you when you are successful in acquiring a job offer. And then we're going to talk a little bit about some of the basics of how to approach the conversations around negotiation. And then we're going to stop our didactic for a little bit, and we're going to go through questions from our audience, as well as questions that folks have submitted ahead of time of somebody who has been in a position to hire multiple institutions. So you can get sort of a peel back of the veil and get the behind the curtains look at how a manager or chief is going to be approaching the negotiation, to ask all those questions that feel very opaque at this point in the process for most folks. And then we'll come back for a little conversation around salary more specifically. I intentionally put that in the end because everybody thinks of it first, but it's really not the most important thing you're going to discuss in your job negotiation process. And then we'll wrap after that. So if I can get my computer to cooperate, as far as just the objectives, we're going to think about the personal priorities you have going into the job series. We're going to focus on the first attending level job, though a lot of the techniques and strategies we're going to talk about really apply to all of your job searches. We're going to talk about the mechanics of the negotiation process and how you're going to approach it. We're going to get that chief and practice manager level perspective on how to negotiate. And then we're going to think about some of the specific items you want to work on before you enter your negotiation, either your next or first negotiation. So just to square this in where we are in the job search series, as well as the job search process, we've talked about how to prepare your CV, how to have a strong cover letter, sending out your materials, how to approach the interviews themselves. And now we're talking about the stage where you have received an offer and you're going to begin your negotiation process. So first, just to review some of the key components of the offer and what you can actually expect to receive. So you will typically receive either one or two formal documents, either a single contract or sometimes an offer letter and a contract. And it should not include surprises at this point. So typically by the time you actually receive a document in hand, you've had a conversation with the folks in a position of hiring you about the major tenets of the contract and the major terms and conditions that you would be agreeing to. These documents themselves are wildly different. So you can have ones that are very thick, very legalese, tons of stipulations and many, many pages, or you can have a very surprisingly brief offer letter. It may be just a couple of pages. It may be much more vague than you expect it to be. So it may say things like, you will do X weeks of clinical service or at the discretion of the division chief. So it won't necessarily be as ironclad or specific as you might be expecting a contract to be. The major components of the offer will typically include the following considerations: a discussion of your salary and benefits, as well as other financial incentives such as bonuses. And the asterisk is there because there will also often be clauses related to how you can access that supplemental income, as well as the terms and conditions of potentially needing to return some of those supplemental payments. So for example, you may be eligible for a sign-on bonus that's written into your contract, but you will also sometimes see language that says, if you leave the institution within X time period, you are responsible for paying back Y% of the bonus that you received. Clinical expectations are typically also included in the contract. Again, may be quite specific or maybe quite vague. There are often some either pre-specified or added in documentation about roles and resources that you may have negotiated a priori for. There will often be terms that can be quite specific about the duration of the contract, as well as the terms of non-renewal. So how long does this specific contract you're signing stay in force? And under what conditions may your employer dissolve the contractual agreement? And under what terms will you potentially be able to break the contractual agreement? Now, within that, there are also going to be stipulations for what will happen if you break the contract or you intend to break the contract. So for example, it may say that you need to provide X amount of notice if you intend to leave the institution. And there will be potentially some sequela if you do not follow those instructions that are contractually written in about leaving the institution. A next major component of your offer are going to be your malpractice arrangements. So I'll get into a little bit more detail of that in a second. And then the last major section of a contract are non-compete or restrictive covenants. So malpractice arrangements, the big things to understand about that is that you probably have never dealt with your malpractice because it's probably managed by your GME. So now would be a good time to just learn some very basic things about malpractice. And it comes in several variants. The two major ones of which you're going to see in academic or private practice medicine are claims made or occurrence. So what that refers to is if there is an act that occurs during the time of your employment, if you have occurrence malpractice, you are covered no matter when that act ultimately leads to legal action. And because we practice in neonatology, we practice with infants, the horizon of time for which we may be liable for an act in the NICU is quite long. So that's occurrence insurance. Claims made insurance only covers you for acts that you commit at that institution that are actually brought to legal action while you still work for that institution. So you can imagine that there may be potentially a gap when you have claims made insurance. And that gap is filled with an additional policy that is called tail insurance. And it's what it sounds like, right? It covers for those claims that may occur after you've left the institution for occurrences while you were at the institution. So in the contract, it should be quite clear if there's claims made, whether your prospective employer is going to pay tail coverage or not. If the employer is not going to pay a tail coverage, there is a possibility a future employer may be willing to cover that, but you should operate on the assumption that it's going to be your financial responsibility to cover tail insurance, and you should make plans accordingly. Tail insurance in a procedural specialty can be in the low tens of thousands of dollars, so this isn't a small consideration. You probably have heard a lot about non-competes in the news lately, and you will continue to hear more. So a non-compete is a type of restrictive covenant. So these are covenants that are installed in contracts to try to avoid you leaving with something valuable to your institution. And I don't mean stationery and pens, right? It's can you take employees and resources, potentially take customers, which doesn't really apply to us in neonatology, and take trade secrets, guidelines, research, anything like that. So typically when we think of non-competes in neonatology, what they are going to say is that you can't work for a direct competitor of an institution, and we'll talk about how they define that in a second, for a period of time after you terminate your contract. And it doesn't matter if your employer terminates it or you terminate it in many cases. There was a lot in the news recently because there was a federal ban by the FTC on non-competes. There was a whole explosion in medicine about how this is going to change the landscape. But there was already a huge caveat in that it didn't apply to not-for-profit institutions. And then it was almost immediately stayed. So it's going through a legal process right now that does not look particularly optimistic that non-competes will be eliminated as was imagined. So operate on the assumption you will probably see non-competes in your contracts. They are typically written with both a time component and a geography component. So for example, you can't work at another institution within 50 miles of this employer for 2 years after the termination of your employment. There may be situations, particularly if a non-compete is very aggressive, very large geographic catchment, very long period of time, where if you needed to leave the institution, you may be able to legally fight the non-compete. You may even have a prospective new employer that's very eager to hire you, who may support you in that process. But again, you can operate on the assumption that these may be difficult to overcome. So when you sign them, you have to take that into account. All right, one of the most common questions that we get in this session is, do I need a lawyer? And I'm going to give you the very vague answer of maybe, and maybe even a little bit of a tune towards probably, depending on what kind of employment you're seeking. So you have probably heard, and many people in the pre-submitted questions seem to have gotten the energy that academic contracts are somewhat less negotiable than private contracts. And to some extent, that may be actually true in certain components of the contract. So typically you're going to hear less stringent recommendations around seeking legal counsel to review academic contracts than private contracts, but it's far more complicated than that. Every contract looks very different, and a lot of the contractual language is often non-negotiable. It's boilerplate. It's used across an entire university or an entire college of medicine or a national organization of private practices. And again, a lot of it is intentionally written to be vague. Now, if you don't understand your contract, to me, that's an immediate indication that you should get a lawyer. So if the legalese language used in there is not something you feel comfortable with, you need to understand what you're signing, right? You need to understand those restrictive covenants. You need to understand the terms of separation. So that would be a good time to consider getting a lawyer. Now, if you have, for any reason, any inkling that you may be in a position to break an employment contract, then hands down, you absolutely need to get a lawyer. So I'll give you a hypothetical example. You're in the process of negotiating a contract. You're thinking you're going to sign the contract. In the back of your mind, there was this job that was so perfect that you would have loved, but they weren't hiring. And then 3 months later, you get a call that now they're hiring and they want to talk to you about potentially hiring you. In any situation where that's even a vague possibility, you should definitely involve a lawyer. And again, it's kind of like an LP. If you've thought about it a few times, just get a lawyer. If you've ever used a lawyer for any other context, you know that they do not typically come cheap, multiple hundreds per hour of consultation. So expect the entire process of a contract review by a lawyer, particularly if there's any back and forthing, to run in the low thousands. And the best way to find a great contract lawyer, which is ideally state specific, is going to be referrals from peers. So talk to your fellow fellows, recently hired faculty. Your GME office may have some leads on good counsel that can review. It's quite rare these days that a hospital's legal team will review contracts, but it's always worth double checking. All right, so now you've got the contract. This offer is in hand. You understand it. It's a great starting place. And now you can start to think about negotiation. So as a general framework for thinking about negotiation, I highly recommend this book. There's some other wonderful ones, but I think this is a great starting place, called Getting to Yes. And really, it's around the notion of negotiation that is win-win oriented, right? It's a situation where we are both going to come to the table and we're going to find a successful agreement that respects both parties' wants and needs and constraints, and everybody's going to leave happy, which for you means you're leaving with a job. So dissolve any thinking about negotiation in the context of transactional behaviors like buying a car. Okay, so this is not, I'm going to go get a Honda Civic and I don't care which dealer I get it from because it's the same car everywhere. That's not going to be the case with your job negotiations. So there's probably not the world's most perfect job out there for you in the immediate offer. So you may need to consider what things are most important to you, and you may need to make some trade-offs. Okay? Some things will be available to you at some point, but they may not be available to you today. And one of the main differences between transactional negotiation and a negotiation like this job search is that you need to preserve a relationship. So you're not going to go in there like a bull in a china shop and drive the person you're negotiating with crazy, acting very entitled, right? And I think a lot of times in medicine, particularly women, and particularly in neonatology, which is very women dominated, we kind of tend towards the opposite. You see a lot of passivity in negotiation. So we're not going to do that either, right? We find the sweet spot in the middle. Okay? Another challenge in this process is that, unlike many transactions, the behind-the-scenes terms and anchors are very opaque. So you don't know what the manufacturer's suggested retail price of this job is. You don't know what previous employees have been offered, so you don't know what an equitable offer might look like for you. So that becomes a much more challenging way to approach a negotiation. And then the other difference is that while buying a car or a negotiation like that is very discreet, you are negotiating a highly complex and multifaceted job offer. And sometimes we distill this down incorrectly to just we're negotiating back and forth on salary, but you're really negotiating how you spend your time and what resources you have with that time. So put aside the salary for now. It's not unimportant. We will talk about it. But remember that time is your most precious commodity. So there are a ton of considerations that are really important in your negotiation, both things that really need to be formally discussed. Like, for example, if you're looking for a research-oriented career, the details of your starter package is critically important to your success. Things that are not necessarily deal breakers, but are important. Like, are you going to have funds to support going to conferences, to network, to develop a national reputation? And you can see here an entire list of things that go well beyond salary that are really important to understand and to negotiate for. Okay, this process takes some time. Okay, so I would argue that the most important investment of time is your pre-work. So understanding what you're bringing to the table, understanding your goals, and understanding what types of resources are going to be necessary to meet your goals. And that's something your mentors, your program directors can help you iron out and think through. Now, you also need to understand in a successful win-win negotiation what is the other party's needs and goals, right? So really rethink this entire concept around what resources do I need to meet our mutual goals, right? A great leader is going to mark their success by the folks that work for them success. So how do we meet that mutual need? So a good approach to a negotiation is thinking about your zone of discontent. So if you have envisioned this world's most perfect job, and then you have a contractually offered job or the job you're currently sitting in, everywhere where those two jobs overlap is your zone of content, right? Everything outside of those bounds becomes burnout. So your goal in this process is to try to align that job offer as much as possible with your ideal first out of fellowship job. So this is something I encourage you to think about, is to consider your highest priorities when you're considering multiple job offers. Think about these in big concepts like geography. Salary can be a big concept. Clinical time could be a big concept. And then really try to get specific about your needs and considerations within each of those big goals. So that then when it comes time to make trade-offs, you're really crystal clear on those priorities. Okay. So once you know what you want, now you can actually meaningfully compare offers and start your negotiation process. And this pre-work, if you share your life with someone else, involves them too. You need to get really crisp on deal breakers, right? You don't have to defend your values. If this is critically important for you to be happy in your job, you don't have to defend that. But understand pretty much everything comes with an opportunity cost. So if you want to live in a very high cost of living environment, there's going to be trade-offs that you have to consider. Here are a couple negotiation terms. BATNAs and ZOPAs are important to consider, although in practical life, they are really hard to sort out. So a BATNA is the best alternative to a negotiated agreement. So very simply, this is a walkaway price. So at what point in this negotiation, right? If let's say we're negotiating about salary or clinical time, what is the extreme at which negotiating any further is simply unsuccessful and I just need to consider a different job? And if you're on the other side of the hiring part of the equation, what is the point at which this person continues to push past this boundary and I would prefer to just hire somebody else? Okay, so once you've identified your BATNA and you do your best to try to elucidate the other party's BATNA, which can be super hard to do. So if you happen to know folks have been recently hired, you might be able to gauge what some of these edges look like based on their previous negotiations. So precedent can be really helpful. Understanding what is the need in that particular division or practice and how you could potentially fill it can help you understand the BATNA. And then when you glue those two together, your BATNA and your negotiation partner's BATNA, what you wind up with is a zone of possible agreement. So it's that range at which both of you will consider this a mutually acceptable outcome, and it's a win-win negotiation. Again, this is true for any one component of the negotiation, like clinical time, where you do your service time, salary, what resources are made available to you, etc. Okay. The really hard part about the job search that we hope to dispel a little bit of the tension around is that win-win negotiation is really hurt by private information. So when neither party has any idea what the other's BATNA is, that's bad for win-win negotiation. Another thing that's really, really challenging in this particular job search is unclear or disparate timelines are really challenging in win-win negotiation. So if you're really looking to stall in a negotiation because you still have a couple interviews to go, and the chief is really, really eager to get this locked up because they've got other people they might consider making an offer to, and they don't want those folks to get snatched up, now you have a mismatch that really hurts a win-win negotiation. Unawareness of precedent and not knowing what you can negotiate for and what you can't also are bad for win-win negotiation. So that's what we're going to focus on in the Q&A, is really exploring these edges of what's negotiable, how do you approach it, how do you ascertain what that other person's BATNA could be. And then when you get to make asks, when you actually get to the stage of negotiation where you're asking for a change in the contract, you have to think about, for every one of those asks, how important is this to me? Do I have data that will support my ask? Have I made it as specific as possible? And depending on the nature of the ask, do I have sort of levels of option? So in the best case scenario, that's my A goal that I would love to get. But if I can't get that, what's B? If I can't get that, what's C? Okay, and then remember to take the perspective of the person hiring you in this process. So just a couple quick examples of simple concepts. So maybe your goal is to have more dollars in your pocket. So negotiating for a higher salary seems like an obvious solution. Well, it's possible that because of equity and precedent, you can't be offered any higher salary. So the person you're negotiating with might not be able to do that, but it's possible that they could give you a sign-on bonus or a bigger sign-on bonus. So you might be able to achieve the goal of more dollars in your pocket in more than one route. And some may require less capital, literally, or socially by precedent from the person hiring you. Well, maybe you're asking for less clinical time. That might not be fair, right? It might not be appropriate to hire people on the same trajectory for the same kinds of salary, but give you less clinical time than somebody else. But maybe what is achievable as a B goal is more flexibility about where you spend that clinical time or the seasonality of that clinical time. And so think about it in multiple levels of intervention. So here's a more detailed example. You're negotiating with your chief. You'd love some more salary. They can't offer you anymore because they already hired 2 other people last year around the same value of what they're trying to hire you at. And then you are thinking, well, what I really want, other than money, is one day I want to become a program director. So even if money isn't necessarily on the table, there are a lot of things you can negotiate for that will make you more successful in reaching your goals. So maybe you can negotiate where you're spending your clinical time relevant to teaching services or non-teaching services. Maybe you can negotiate for a starting level position on a committee that is medical education related that's going to give you a trajectory towards a higher leadership role over time. Maybe there's an opportunity to negotiate for money for certifications or courses or conferences that are going to improve your educator skills. Maybe you want to go so far as getting a master's degree, but doing that in the normal clinical time may be really challenging. So you can try to negotiate for some time protected for that. And then again, you can always ask for more salary, but be prepared to consider something like a sign-on bonus as an alternative. All right, so remember, win-win. So start by understanding the offer in great detail. Understand all of the trade-offs and all of the gotchas and loopholes and potential ways that you can have to pay back money, understand what happens if you leave, understand all of the potential added benefits that typically are ignored in a contract. So a lot of times people focus around salary, but they spend very little time thinking about things like retirement benefits that can be very lucrative. And then don't forget, if you're in an academic setting, to really hone in on what are the guidelines for promotion and tenure. It's not something you're going to negotiate, but you really need to understand the climate in the institution. And if you're going to be working for a private practice that has the option of buy-in, understand the tenets for that. All right. The next major step is figuring out the ground rules of the negotiation. So when you've received your offer, you're going to make contact. You're going to appreciate this offer. We'll talk about some suggested language later. And then you're going to establish the terms. So who will I be negotiating with? When should that happen? And how would you like to talk? I would love to discuss this offer with you in more detail. When would be a great time? And how would you like to connect? By phone? Let's jump on Zoom. Many of the things you're going to ask for, if not most of them, will be at that negotiating party, the person who's prospectively hired, you use discretion. It's possible that some things will have to go through additional individuals at the institution. You want to negotiate everything you're looking for simultaneously, right? So you don't want to sit down with Dr. Reber, go through a whole negotiation. I want X, Y, and Z. And then 2 weeks later be like, and these other 3 things that I forgot to mention or didn't mention yet, I'd like to negotiate for those 2. Don't get caught in the trap of negotiating just for the fun of it or because you were told you were supposed to negotiate. These should be meaningful asks that will affect the quality of your job experience. And then don't be afraid to ask for time. So if you do want to seek, legal opinion, if you are still in the midst of other interviews, ask for some more time. I really want to give this contract thoughtful consideration. Do you have a specific timeline where you need my response from in that timeline? Or can I get back to you in 3 weeks, 4 weeks, whatever you need? And then remember that it's great to advocate for yourself, but you should also want to work for an employer that is committed to equity. So you should not be really excited about a situation where if you just negotiate harder or more skillfully, you're going to get this wildly more lucrative contract, because that means somebody might be on the receiving end of an even better contract than you are for no real merits. All right, so we're going to pause here. We're going to work through some questions. So you're free to put questions in the chat anywhere you would like. You can interrupt or build upon questions, and I'll get us rolling here. So as we open this negotiation, first, can we talk just a little bit about how you would typically like to engage in a conversation around the negotiation? Is this something you want to do by phone? Do you want somebody to send you an email? How would you like to approach it?
Is that my question?
Yep.
So I think it starts with email and spending that sense of what your interests are, and if this is the appropriate job to even begin to have a discussion about. So it starts with email, but then what I typically do is start with a 30-minute just meet and greet Zoom call, just to get to know you and understand what you are looking for, so that we can say, okay, is this going to be something that is mutually of interest to both of us? And then if we decide to move from there, then I have that person meet with multiple faculty. So I think initially by Zoom, I do a brief call, and then we switch to make sure that the interviewer or the candidate gets to meet a lot of the faculty.
Yeah. So then we get to the point where they've done a first visit, maybe even come for a second visit, maybe their family's even in the area. You're excited, they're excited, you provide the offer.
Yep.
So how does that process begin to unfold? And let's talk, there's a nuance there, maybe that academic, the timeline and speed might look a little different than a private practice.
So if I would initially send an email and let that person know that we'd like to put give them an offer, and that we're in the process of working through that offer. And that takes time. So I may say, I'm going to offer you a position, and then I have to send it back and get the salary and all of these other pieces and parts behind the scene and get the contract up and running. So oftentimes I may talk to the person via Zoom or by phone and say, this is where I think the offer is going to land, roughly. But I'll give you the actual contract as soon as I get it back. And that can take a couple weeks to get that contract back.
In that stage, would you typically have gone through some very specifics around clinical time, around specific resources, or candidates typically sort of waiting until they see the contract in hand to get into some of those details?
So I typically share all of that, and I am one of those people who want everything to be equitable. So I typically share all of that during the interview process. So if you interview with me, and I think with a lot of division chiefs, they're going to say, okay, my faculty work 1,600 hours. Here's the expectation for call. Here's the expectation for clinical coverage. Here's where we have flexibility with clinical coverage. Here's what ECMO call looks like. You can do or not do ECMO call. Here's what our real needs are, those types of things. So I have a lot of those conversations. So there shouldn't be anything surprising in the contract. Sometimes there'll be some surprise, or not surprises, but I may not know the exact salary if I haven't hired somebody else at that same level that year. So I'll have a rough idea of what the salary will be, but I won't know until it actually goes through our resources that decide what the salary is going to be. But a lot of the other things have already been discussed.
Are there any nuances to how that first offer could play out differently to somebody who has a unique training background? For example, somebody who is dual trained in more than one field.
Yes, for sure. So, and I think it depends what that person wants. So if somebody is dual trained and they want to work part-time in one division and part-time in another division, that becomes a little bit more complicated, but doable, because it's probably a joint recruitment. So then it requires multiple layers, especially if that person really wants to spend clinical time in both areas. So then it becomes a dual recruitment. Now, if it's somebody, I think an example that was given, I'm palliative care, but I really just want to work in neonatology and really be that palliative care neonatology person. It may not necessarily be a dual recruitment per se, or say a neonephrologist, and that person is going to build our nephrology program in neonatology. So the only difference would be that you'd probably be able to negotiate for a higher salary, right? Because you are bringing something else to the table. And I think that's the key. And you alluded to that in your presentation. There's not a lot to negotiate with salary. And you should be concerned if there's a lot of wiggle room with salary, because there's going to be a lot of mistrust when you come in, right? So if you go back to the table and say, okay, I want $20,000 more, and they say, okay, that's fine, and somebody else was hired at your same level, right? You're always in the back of your mind going to be thinking, wait a minute, did I negotiate well enough or not, right? And I'm very fair with when I have new fellows starting right out of fellowship, there's not a lot to negotiate in terms of salary. And so it's going to be equitable. And if for some reason I go up on somebody else's salary because I don't know, I'm trying to think of an example, but I would go up on the other person's salary. So I would keep it very equitable. Sometimes what can happen is I'll have a person who lives in, say, Houston, and they'll say, can I get a sign-on bonus? And we don't typically give sign-on bonuses, but I may for that person because I'm paying $10,000 for somebody else to move from Ohio, for example. So there may be those types of things, but I would be very transparent with everybody about this is what's happening, because I don't want people to come in and have that level of distrust that I'm not being paid as much as somebody else.
That's it.
Mhm.
I'm gonna say you hit on three things right away that we've kind of covered that are financially related in terms of salary, relocation expenses, and sign-on bonus. What are some other things that you feel are easily negotiable? And then we'll flip over to things that are very difficult, if not impossible, to negotiate on.
Mhm. Well, there's not a lot negotiable in academic medicine. I always feel bad when you guys ask me to give this webinar because I'm like, well, there isn't a lot to negotiate for. I mean, there always is something, but, and let me say this, you should always just ask. Don't be afraid to ask. And we all are very uncomfortable asking for things. But just ask. So I think, some things that are negotiable, you outlined nicely. If, say you're interested in med ed, thinking about how can you support my career moving forward? What are some things that we can do together to support my career in med ed? Right. Of course, I'm not going to be able to promise you are going to be my next fellowship director, right? And there aren't many division chiefs who are going to be able to promise that to somebody who's just coming out of fellowship. But certainly we can prepare you for a career in medical education. So I think those are types of things that you can talk about and you can negotiate. Most contracts, when you talk about clinical time, it's not really negotiable, and it probably shouldn't be. It goes along with the salary, right? Do you really want to do less clinical time than your partners, right? Do you want to come in and say, well, I only have to do 1,400 hours and you're doing 1,600 hours, right? We try to keep it equitable across the board. And there may be extenuating circumstances that are different. You start to run programs or you start to take on leadership roles, of course, that's going to change. So clinical time isn't really negotiable, and a lot of contracts don't say exactly what your clinical time will be. And people ask me that often when they're negotiating their contract. I want it in my contract what my clinical time is going to be. And it may say that, but it's also going to say at the discretion of the chief, right? And that makes sense because if 5 people left for some reason, we have got to cover the neonatal intensive care unit. So it does flex, and I have a lot of people who come back and say, well, I wanted in stone that I'm never going to work more than this, right? And that it's just not feasible in any practice. Now, what I do say is if suddenly you're having to pick up more clinical time, my current state is that I can pay you extra money, right? I can moonlight, but I can't promise that that's going to be the case, a year or 2 from now.
Yeah. How about things like starting dates? Flexible?
That is
Partially
very
flexible?
flexible. Starting dates are very flexible. That's a good point. Those are very flexible, and most fellows don't start immediately after they finish their fellowship, but make sure you have healthcare insurance. That always makes me nervous. I'm like, make sure you have healthcare insurance.
Yeah, we do a brief aside on that. But remember that when you've separated from an employer, if you have an employment gap, you are eligible to do something called COBRA, which is a federally provided insurance extension. COBRA is pretty pricey because what it's actually happening is you're paying your part of the insurance, but you're also paying the employer's part of the insurance, which is a lot more than you might recognize that it is. The nice thing about COBRA is that you can actually not elect it until you actually have a need for health insurance. So if your gap of employment is relatively short and you're lucky and you don't have routine or expected healthcare needs during that time period, COBRA is a nice way to bridge that gap. And it might not cost you anything, but that is something to consider, not just how are you going to pay the bills during that period of time that you're not employed, but the health insurance is a potentially catastrophic issue if you haven't thought it through a little bit.
The other thing to think about too is if you're at an academic institution and you're staying at that academic institution, it may benefit you not to have a gap, right? Because you may have continual time of service for that institution. So just really make sure you understand what that gap means.
That's great, but that can sometimes affect things like vesting in your retirement accounts and other resources. There's still institutions and practices that have pension type of arrangements where that time of service can be important.
Right.
Okay. I think there's a tension that I alluded to earlier. Sometimes people don't want to come across as too aggressive, right? And then equally, people can come across too passive in the negotiation process. So what would you advise as far to how to strike that line in the middle? Or you could also offer some examples of maybe things you wouldn't do on either extreme.
Yeah, I think tone is a lot of it, right? Just having a conversation with somebody and saying, I'm, and I think it's fair to say this is one of the first times I'm negotiating a contract, but see, these are some things that are important to me, right? You definitely don't want to burn your bridges, and you definitely don't want to push something and then suddenly have them walk away and say, well, okay, I'm not going to do that, right? So I think it's probably best to do maybe with a phone conversation. I think that sometimes can be interpreted better than email. So having that phone conversation with somebody and just saying, what is the flexibility? I would really like more pay, especially if you have another contract on the table. And that's something I do encourage people to do. If you've gotten a job offer from somewhere else and it's significantly higher pay, bring it to the table, right? Because if somebody else comes to me and says, "Hey, I'm getting paid $20,000 more somewhere else," then I can go back to my compensation group and say, "Hey, that I'm competing with XYZ, and this is the compensation." Now, I would go back to I mean, but don't lie about that, right? Because that could really bite you in the tail end. But if that's happening, then I can go back and say, hey, they're offering somebody else this, and it seems like across the board, your fellows graduating and getting new jobs are getting more pay. So I can go back and negotiate. So I think those are the kind of things that are good to have a conversation by phone. And then, email, sometimes the tone can be misinterpreted. So I would just have a conversation.
Agree. You mentioned sort of that there's always folks in the institution or practice that are on the financial end of the equation. So how do these individuals benchmark salaries? Like, what are some of the resources out there? And then are these things that the fellows can access, or are they secret?
They tend to be secret to everybody. So our institution, for example, uses the AAMC and Sullivan Cotter, kind of a hybrid of the two, and so it can be very confusing. And so it's not very transparent what people are using. So I think that's why it's probably not a bad idea to talk to different institutions and to see what other people are getting, what other offers are on the table. It's going to vary by region for sure. You're going to get paid very differently on the West Coast than you are in the South, than you are in the North. So just be very clear about that. But it's very difficult. And we have this conversation all the time. I certainly, every couple of years, we have these regroups where we talk about, our salaries fair? Do we need to increase everybody's salaries? Those types of things. So I think it's hard to know, but I think it helps to have multiple offers on the table so that you can compare.
And there are some hospital systems, they're relatively few, that will publicly publish, salaries for physicians. The AAMC resource, I'll talk to you a little bit after we break the Q&A. That is information that most fellows can access, and I'll kind of go through some of the numbers for neonatology to give you sort of a relative concept of where these numbers land. But the AAAP, which is typically used by many academic centers, and the MGMA data used by a lot of private practices, is very secretive. You can sometimes find old versions of it floating around here and there on social media and things like that. And then there are some attempts to increase transparency. So there are resources like Doximity where people can crowdsource information about salaries, but you have to take that with a grain of salt because you don't know if it's accurately reported. And you also don't know the nuances we alluded to earlier, like a double boarded person. That sort of detail cannot be folded into that resource. Nicole's curious, what is the conversation at the level of maybe, the AMSPED Act department chairs in pediatrics or division chiefs? Like, can we move towards an environment of more transparency with salaries?
That's a very
I
good
won't make you
question.
speak for anyone else. Just
Yeah,
curious
yeah.
if there are conversations happening about this.
That's a good question. And I think we're all struggling, and I think it's a bigger conversation than we probably can have, because part of our problem right now is that pediatric subspecialists make less than a lot of general pediatricians, not neonatologists per se. But a lot of our neonephrologists, for example, make less money than do our general pediatricians. So bless you. So there's a lot of discussion about how do we make this fair? Do we ramp up our subspecialty salaries? So I think there is a lot of discussion. It really depends. It's hard to make it completely transparent and to be equitable across the board because different institutions have different resources. And so it's not apples to apples across institutions. So what one hospital resources are compared to another are very different. So it would be very hard to have that expectation that they're equitable across the board. But I do think we need in general to raise pediatric subspecialty, or we're not going to have a specialty anymore. So we're not going to have children's hospitals anymore. So, but that's a discussion for another day. I will say it's an important question to ask. How do you increase your salary? Because you will talk to some of our colleagues across the country who start out in their job and don't see a pay increase for 5-10 years. And that does happen. So I think it's very fair to ask what historically has happened in terms of my salary increase. Is there a bonus? Do I get bonuses based on my RVUs? So I think all of those are very important discussions. And sometimes it's only if you get promoted. And if you do get promoted, what is the increase? So, and that's the other question. How do you get promoted, right? Because if you go to some institutions, getting promoted is an act of God. Sometimes it feels like, where other institutions are very reasonable and they're supporting people who are doing advocacy work, QI work, those types of things in terms of a promotion pathway. So you should ask all of those questions if you're going into academics.
Yeah, that's a great question. I guess I took for granted that most institutions had like annual raises, like cost of living raises, let alone like merit orient raises. And I see on, discussion boards all the time, like I haven't had a raise in 10 years. I've worked at this institution or this practice, and that's, adult and pediatric medicine.
Yeah.
So it is an important question to ask, and again, you can, in your process of going through your first or second interviews, ask for things like, can you give me examples of how bonuses are calculated? Can we talk about some of this as you get past those initial conversations, where then there tends to be more transparency around some of the salary and financial considerations.
Mm-hmm.
What is your take on the climate of loan repayments and how this influences negotiations? So we know that many, but not all, academic institutions may qualify for public service loan forgiveness, and that outside, so employer provided loan forgiveness packages are more common, but certainly not universal in private practice. So anything you would sort of add to that initial volley as far as student loans?
No, I admittedly, none of the institutions where I have worked have offered loan repayment per se. I think definitely making sure that if you think you're going to qualify for loan repayment, that your institution sets you up so that you optimally qualify. But I know there are institutions that do repay loans, but I don't know the specifics about that, admittedly.
I would definitely ask for sure. And I think your point is well taken, that you shouldn't assume just because it's a not-for-profit or children's hospital, or if it's affiliated with the university, that it automatically is a 503C IRS institution that's going to qualify for PSLF, because it's not uncommon that a hospital, which may be not-for-profit, contracts with a group that is actually who employs the physicians, whether they're private practice physicians or academic physicians. And it's that group that may or may not have that approved status, and that can be really important.
Yeah.
Shout out to some efforts trying to improve loan forgiveness program for pediatric subspecialties. There's work at the legislative level. The first volley was not useful at all because it really required such an outsized amount of clinical time that it excluded the majority of even folks in private practice fields like neonatology, because it was just really designed to serve almost a primary care and psychology community. But hopefully we'll continue to see some iterative improvement in that program. That can be something that folks can access. And then there was also some elegant modeling work that showed that even if we had loan forgiveness, it would not close the gap in pediatric versus adult salaries, or in pediatric subspecialties as compared to primary care. So while asking about loan forgiveness is really, really important, we're probably not going to see huge landscape changes nationally around this issue in the short term.
Yeah, no, and I will say that you may see some of your colleagues graduating from other pediatric subspecialty programs with more negotiating power, right? I think every children's hospital's chomping at the bit to get a hold of an infectious disease doctor, and some of these less common subspecialties. So they're probably still going to make less than the neonatologist, but they probably have some more negotiating room. So
Yeah, that's definitely been my experience at the super fellowship level, just seeing folks in other subspecialties. A lot more difference between individual contracts based on the need of that facility at that point for a subspecialist of that ilk. Okay. I lost the question I was just going to ask you.
So Sarah, you asked a little bit about academics versus private practice. And
Yeah.
yeah. You know, I think it depends on the private practice, and private practices are kind of going away. You know, you see less and less of them. There are some out there for sure, but you see less and less of them. And I think the thing to keep in mind with neonatology, you know, I look at Houston. Every single hospital system has a very different approach to salaries, to reimbursement, to whether RVUs are important or not important, whether it's a children's hospital or not. We have 3 children's hospitals on the same street, and I guarantee you they all manage contracts and salaries very differently, and the clinical commitment. And so there are nuances with all of those. And then you kind of have those pseudo academic, pseudo private. So I think I would just ask those questions. Most private practices really have an RVU based payment schedule. So you work a lot of hours and you generate your RVUs, and then at the end of the year, you get a bonus. And so, but know exactly how that works. I mean, ask those questions.
Yeah, I think another major consideration that you just opened the door in difference between academic and private practice is how clinical time is allotted and how you determine that in negotiation with the person you're hiring. Because most private practice remuneration is basically pay for play, right? So the more you bill, the more salary you generate. So depending on the needs of that practice, you often will have a great deal of flexibility in exactly how much clinical time you do.
Yep.
And the pay is commensurate with that. If we could first start, because there was a really great paper just published by the peds endocrine folks that showed that even folks that are in job search really don't know what the climate of clinical time versus protected time looks like in academic practice. So drawing some general sweeping conclusions, you know, when you think about folks going into those academic careers, what sort of allotment of clinical time versus protected time exists on the core tracks that you're going to see.
So it is different everywhere. And those are definitely the questions you want to ask. And so let me give you this example. So when I was at Nationwide, we had 20% protected time and 80% clinical time. But that 80% clinical time was it was over 2,000 hours. I think it's cut back since then, but it was over 2,000 hours. So you were doing 80% clinical, you had 10 to 15% protected. I forget how it was broken out, but it was 20% basically was protected time for either leadership or teaching or other things. At Texas Children's, I have 100% clinical FTE. And I tell everybody it is 100% clinical FTE that you do, and it's 1,600 hours. So even though it's 100% clinical FTE, it's less time than 80% somewhere else. And so that's why you just have to ask those questions. And I have chosen to do it that way because then I don't have my administration nickeling and diming me for less protected time, right? I can say, nope, they only do 1,600 hours, but then I do let my faculty know, but now your teaching and your academics is beyond that 1,600 hours because 1,600 hours is relatively low across the board for neonatology. So you have to ask those questions. And I have people who are interviewing with me all the time say, but I want some protected time. I don't have any protected time, but you actually are more protected because you're already doing 100% clinical. The administrators can't come back and say, no, you need to do 120% clinical time, right? So it's just a different approach to it. And that's why I have chosen to do it that way. So you should ask the questions. Don't assume that because they say you have 20% protected time, that it's better than across the street where you have 100% clinical time. Does that make sense?
It does. It is 100% institutional dependent, and really, like, even if you're like, I just need to pull out a piece of paper and walk through this math with you, like, help me understand what it means to be 70% FTE or 100% FTE and how many hours, and you know, what does that trajectory also look like over time? right? So you
Yep.
may not come in an institution that does offer allocations of protected time. You may come in at sort of the baseline everyone on your track gets hired on,
Yep.
but there may be an opportunity if you get X leadership role, or you take a role at the medical school, then you might be able to get some protected time. So understanding those pathways is important too.
Yep, exactly.
Okay. I'm seeing a lot more conversation around work-life integration in lots of ways, but one of the ways I'm starting to see it show up more is in folks wanting to work less than a typical full-time equivalent,
Mhm.
whether that's in a private practice setting or an academic setting. What's been your experience of where this trend is going? Are you starting to see it more, have more conversations around that? And I think particularly from the academic lens, how does that potentially interface with people who want leadership positions? Do those feel mutually exclusive, or is there a pathway still to leadership and part-time work?
Yeah, so I would definitely say they're not mutually exclusive. I think you can still be very active academically and work part-time. I'll be really honest, I struggle with it as a division chief. I mean, I always encourage all of my team, ask what they need, right? If they need some time or need to work less clinical time, always come talk to me. But it's a struggle, right? Because somebody's got to do the clinical time. And so as soon as I say, you know, Liz, if you come to me and you say, hey, I want to work 0.5 time, right? Or say more 0.8 time. So I'm cutting back your clinical time. Well, somebody else has to do it, right? And I can't hire 0.2 FTE. And so that's where it gets to be a real struggle. And I worry about it with my other team members. And so I'm being very transparent with you, because what I know the right thing to say is, yes, take the time you need, do what you need to do, but it can be really tricky sometimes. But I do try to support, and I do have a lot of faculty who are working part-time, so it certainly is reasonable. And yes, I think you can be academically successful, but I think you need to be present, regardless of whether you're working part-time or full-time. I think the key to being successful in any job, and this is a different conversation, is to be present.
Well said. All right, I think we'll wrap with just maybe a couple more questions. So timing, right? So there's obviously a lot of delicacy in the timing of the entire job search, right? Disparate timelines overall. But when you get to the point of actually being made an offer, typically what does your timeline look like? How long would you have to start at least the negotiation process?
So you should have at least a couple weeks. And I'm always very honest with the folks, and it can get really tricky. You know, sometimes I have literally, I think there was one year that I had 10 people. I was trying to decide, you know, who to offer, and we were hiring 4 people, and I was trying to, you know, so it gets really tricky, and you're trying to not let the people that you aren't going to offer a position necessarily, if you take the position, go while you're also trying to negotiate. So it is one of the most stressful things, I will tell you, as a division chief, that we do, and that is juggling all of these different individuals who would like a job, who you're trying to prioritize, but you're also trying to give the person who is the candidate the time to really think about the offer and to interview other places. So I'm pretty open, right? And I'll give folks a timeline, and I'll say, listen, I really need to know back in the next 2 weeks or 3 weeks, and so that I can offer it to somebody else if you're not interested. So I tend to be very transparent about what's happening. So, but it just varies. I mean, there may be some folks who don't have anybody else who's interviewing, and they can say, well, take the time you need, and you know, and I'm not going to push you.
And I would encourage you to similarly be transparent,
Yes.
right? So not, oh, I'm on service, I'm kind of busy. That's probably not a good reason to,
Right.
Essentially reject a timeline that's been proposed by somebody trying to hire you. But if you have an emergency, you have to, leave for a family situation, like, please, you can share whatever you feel comfortable sharing and say, hey, I'm in the middle of a crisis right now. Can I please get back to you in a couple of weeks? Really, don't be afraid to say what you need either, and that you'll work together to find a mutually agreeable solution.
And or even being transparent about the fact that I have another interview next week, and so I'm going to interview with them, and I need to wait and see what they say. I mean, I expect you to be interviewing in multiple places, so it's okay to say those kind of things. That would be my expectation, but I think it's just a conversation. The worst thing you could do is not respond. That is the absolute worst because you're afraid to say anything. And so dragging your feet and not responding, that is the absolute worst thing you can do.
Yeah. And it might even sound wild that you had to say that, but a lot of people, when they get nervous and they aren't sure how to proceed, just don't do anything, right? Or you might be waiting to get some counsel from very busy mentors and you're stalling and stalling and stalling. And now it's become uncomfortably long since you've answered a message. So always better to answer the message promptly and say, I'm going to consider this. Can I get back to you in a week or so? Than to say nothing at all. All right. Well,
Yeah,
always a pleasure to talk with you. Go ahead. I was going to see if you wanted to offer any sort of parting thoughts, anything we haven't covered that you would give advice.
I think enjoy the process. It's stressful, but I will tell you, interviewing for a job is so different than fellowship, right? Because you're really going to get to know the people you're interviewing and take advantage of that and get to know the program. I think it's to your advantage. I mean, there aren't many times in your career that you have an opportunity to go to multiple different institutions and get to know people, and you'll remember those people that you met. So enjoy the process. And, you know, I think most chiefs are pretty open to having a conversation. I always say, just get on the phone and let's have a conversation. This is stressing you out. This worries you. Let's have a conversation about it. I'm going to be very transparent with you, or at least tell you what I can share with you. So I think, enjoy the process and ask a lot of questions and make sure you feel comfortable. And if there's anything you do feel uncomfortable about, those are the things that you should bring up and talk about.
Absolutely. And I don't say this to create more pressure, but I would also leave you with the parting thought that while this feels like a very big negotiation, if you happily come to an arrangement to work for this person you're negotiating with, you will continue to negotiate in small and big ways for the entire time that you work together. So laying a great working relationship and foundation for negotiation in this process is really, really important.
And
All
and
right.
I say this, I said this in the beginning, and I say this now. I think you should negotiate, but there's relatively little that you can negotiate at this stage in your career. And so that to me, when somebody said that to me, it actually took a lot of stress off of me. It's like, okay, all right, so I'm not screwing up by not pushing for another $30,000, right? Because I always had this in the back of my mind. I'm not negotiating. I'm not negotiating. So I think at this point now, if you start to go for a division chief job or a job with a title where you're going to need all these resources on top of it, or a research job is different, right? Because you do need resources to support your research. That's different. So take a little bit of stress off yourself that you know there's only so much you can negotiate, but do ask the questions that, like we talked about today, that you can ask.
All right, terrific. Thanks so much. So we're gonna wrap up just with a couple of requested scripts. So how do I say some of this stuff? And then talk a little bit more about salary. So just first, I've interviewed a lot of practice directors and division chiefs and also newly hired faculty to just kind of round out the discussion. These themes have all shown up, but the top tips you can see here, don't be afraid to ask. So if you don't ask, you're not going to get in most situations. Be timely in your follow-up, right? Don't drag out this process and don't be avoidant. And don't take things personally, right? This is not a referendum on the quality of you as a candidate if something is not negotiable. And something may not be accessible to you at this stage in your career, but it may be available to you in the future, or something may change in the environment, in the practice, or the institution where something that's not an option today becomes an option in the future. And then as far as newly hired folks, I said, don't be afraid to stall. So if you are in the process of still interviewing or you're waiting an offer for an institution, don't be afraid to say so. Be honest and transparent. You know, I'm awaiting a contract from another institution. Do I have, a few weeks to think this about it? If you are discussing something of importance to you, it's always great to get in writing. You may not get it in a contract, but at least summarize the discussion. Thank you for the wonderful phone call. I really appreciated the conversation. This is what I understood from our discussion. Does this meet your understanding of what we talked about? Remember that these new attendings remind you that money is not the root of all happiness. There are a lot of other things to consider in your job search, and that work-life balance becomes the top reason why most folks stay or leave a job. So take that into account during this process. And then again, they encourage consider a lawyer.
And Liz, can I throw in there?
Please.
We didn't talk about this, but work environment is huge. And I have worked in environments that are toxic and it is miserable. And sometimes it's hard to tell in an interview, but ask those questions. Ask the people you're talking to, are you happy? What are you happy about? Do people get along? And you should be able to tell if people are real hesitant and say, well, yeah, we, for the most part, I mean, I can say with utmost sincerity, I work with amazing people. And sure, we have our disagreements, but we agree to disagree and we move on. And I work in what I feel like is a very collegial environment. So, and that is huge. And so try to get that sense from talking to the faculty, because it is not worth making more money and being in a toxic environment where everybody's, talking behind each other's backs and those types of things. And those types of places exist. So definitely ask those questions of the faculty that you do get to meet with. And if they don't let you meet the faculty, there's a problem too. So
Major red flag right there. Yeah, we talk about this a lot in the fellowship interview process too, right? We talk about the culture. We talk about the difference between fitting in and belonging, right? So if you don't feel a sense of belonging and connection with your coworkers, this job is already hard enough. That's going to create a ton of unnecessary stress. And ultimately, you're not going to want to stay in a position where you feel that tension. Okay. Here are just some examples. I'm not pretending these are perfect, but people have said, I have no idea what to say about certain elements in the negotiation process. So here's some examples. Feel free to get a little screen grab or take a picture of this. But you can use some of this verbiage to approach the conversation around, I need to stall a little bit, right? I'd like to take some time to think about this. Can we speak again in X amount of time? Asking for clarifications, helping somebody understand why you're asking for something, like I want to potentially sit on a committee, or I'm going to ask for a signing bonus. Be able to provide a little bit of language as an example of how you might ask for something like that. If you have multiple job offers, try to compare apples to apples. So we talked about things like the complexities of clinical time. Okay, so you can't just say, oh, it's 80% versus 100% clinical time. You have to be able to get into those nuances. It can be helpful to reference an element of the competing offer, like a higher salary, for example, but it may not be pertinent. So if you say, oh, well, this institution says I only have to do 2 weeks less than that of clinical service, can I have 2 weeks left? That may not be useful information. The chief may say, well, no, everybody who's on this track works this amount of time. I can't just give you 2 weeks less than everybody else. Clarify timelines and then stick to them, as we talked about. And again, be respectful of everybody involved in this process. And that absolutely 100% involves all administrative staff involved in this process. Okay. And then once you have come to a decision, be prompt and honest about that so that everybody can move along with their process. So if you have other places that you're still talking to, you need to talk to them right away. And then here are some examples. So asking for clarifications around when we're going to negotiate. What do you say if you're feeling some pressure about a job offer, but you still have another first visit? So being able to open the door to a conversation and be honest and say, I've got another visit. Do you have a specific timeline for when you would need to discuss the terms of your offer? What do you say if you have come to the conclusion that you're not going to continue in the process of negotiating with this particular employer? Be grateful, right? They put a lot of time and energy and probably money into recruiting you. So thank them, be appreciative of the time that they spent on you. And then I think a lot of people agree, and personally, I feel like it's nice to tell people where you're heading. They're going to find out anyway, because it's a small community. So I just think it's kind of nice to let them know where you're heading, and that again, that you appreciated the opportunity to spend some time with them, and you acknowledge that we're a small community and you're going to bump into each other again. So be respectful and prompt in closing the loop too. All right, let's talk about salary in a little bit more detail. So first of all, salary is often used as a shortcut, but what we really are talking about is total compensation. So typically total compensation does not include benefits, but remember that you may have a particularly lucrative retirement supplement that's really substantial amount of dollars in your pocket. It's not technically folded up in total compensation. So usually when we say total compensation, we're talking about the contractual salary, any fixed supplements. So for example, if you're gonna be a medical director of a unit, you may get some additional pay. And then whatever the incentive or bonus architecture folds up into total compensation. And this can look very different from institution to institution. So let's just take 3 examples of NICU jobs. One of them may give you a flat salary, and it includes all of your clinical obligations and non-clinical obligations, and you get small bonuses. And you would ideally ask, what is the architecture of the bonus agreement? You could have another institution where you have a fixed salary that is somewhat smaller, and then you get additional pay for the calls that you take. And then you may or may not be eligible to take more than the minimum requisite number of calls for additional payment. There may also be practice models where you get a certain flat salary just for being there and doing the work. And then depending on how much revenue you generate, you get larger bonuses that add to your total compensation. So this is why it becomes very difficult to compare salary from institution to institution, because there can be a lot of unknowns. So if you are in a revenue sharing payment model, it's going to be really important in your process of exploring this job opportunity, what typical revenue generation looks like for this practice group, so that you can begin to consider what your likely salary is going to be. We alluded to this, that pediatric subspecialties do not make enough money. NEO is not on this first table on the left because there is no equivalent adult subspecialty. The same is true for OB-GYN is not on this table, but you get the sense that peds is not doing great from a financial standpoint. And then when you break down the peds subspecialty specifically in this table on the right, if we norm to general peds, if that's the 0 line, only cardiology, critical care, and neonatology earn more over the course of their lifetime than folks who went straight into general pediatrics. All the other peds subspecialties make less. This climate is starting to turn a little, in the sense that some departments of pediatrics are now paying all the subspecialists at least as much as general pediatrics, but that's kind of an early adopters trend right now. The AAMC is the place where you can access the most publicly available information. They charge a lot unless you're already a member, and then the charge is very nominal. So find out who in your GME has access. This is the kind of data you would find there. I'm not saying it's the exact data, it's just the kind of data. And you will be able to see the data broken down by the rank, by the region, and you can find some data on gender and race ethnicity as well, with the caveat that while in a specialty like neonatology, there are a lot of women, so that gender data is pretty robust. The racial and ethnic data is not, because we are not representative of the general population in neonatology. But the way this data is presented, should you be reviewing the AAMC data, is that they will provide you for that rank for assistant professors, the 25th percentile, the median, and the 75th percentile. And one important thing to remember is that assistant professor as a rank, for example, rolls up a lot of people at different years of experience. So that's year 0 people walking in the door, but it's also people who are very close to the next stage in their career, becoming an associate professor. So some institutions will say we start at the 25th percentile, or we start at the median, but it's very rare that you're going to see offered salaries at these high levels of, 75th percentile, for example. And then, as Dr. Reaver mentioned, the region becomes very pertinent too. So you might expect in the central region that salaries may be somewhat lower compared to, say, the Northeast or the Southeast region. And then if you do review these data, I urge you to look at the gender and race ethnicity data, because it is quite striking. So in neonatology, you can see that white women are earning less than white men, that Hispanic women are earning substantially less than everybody. And then again, small number outlier potential phenomenon here for Black men. So salary inequity is real. And the data suggests that this gender pay gap starts in this part of the process, so right out of training. So if you control for everything you can possibly think of, and trust me, I try to think of things, and even if you use a very discrete population, like only folks going into early career physician scientist tracks, there is about a $20,000 per year gender pay gap, and the racial pay gap is actually higher. And that doesn't sound like a lot, but when you extrapolate that over your entire career, we're talking about millions of dollars. So there was a group within neonatology, including Renata Savage and Eric Horowitz, who went through and explored compensation for neonatologists. And they indeed found that women neonatologists were paid less, even a larger pay gap than was seen in this previous study. And that the aggregate impact of that pay gap amounts to $3.5 million at the time of retirement, if invested. So why do I say this? There's a few things that we need to remember. So if you are a woman, remember that negotiation is important. So 20% of women don't negotiate at all, and men are going to negotiate 4 times as often as women. When it comes time for future career opportunities, whether it's applying to be promoted, whether it's applying for a leadership role, men are going to apply for a job when they meet about 60% of the qualifications, and women will wait until they meet essentially 100% of the qualifications. So negotiate. You have to know the numbers. You have to be aware of this inequity. And one interesting piece of data is that practice makeup correlates with gender pay gaps. So if you are a woman applying to work in a practice where the majority of the practice is made up of men, you are more likely to receive a lower salary offer than a man. So keep that in mind. And then the thing I really want everybody to remember is that salary equity is everyone's concern. So no matter who you are or what your background is, I would urge you that when you are on the job search, that you're asking questions about salary equity. How are salaries determined? How do you ensure that they're fair? Because we should all be committed to salary equity. All right, that is what we have for you today. I'll double check that nothing has jumped into the chat for questions. You have our contact information on those first slides. We urge you to reach out if you have any questions. And I will leave you with the echo that as stressful as this process is, and it is very stressful, it's way more stressful than the match, in my opinion, it is actually also enjoyable. And we're really looking forward to y'all becoming full-fledged members of the neonatology community. And if you need us, please reach out. Chris, anything you want to end with?
No, I just will echo what you said. And I remember we are a tight-knit community, right? There aren't that many neonatologists in the world. So you will, and that's what I love about our specialty. You'll start to get to know folks, you'll go to meetings and you'll see a lot of people you know. And so again, this is a process as you go through it that you'll get to meet a lot of those people. So enjoy it. And certainly ask questions. And I know Liz and I are always available to ask questions too.
So have a terrific night. For all of you who are watching, have a terrific day or morning or afternoon, whatever it may be, and best wishes in the process.
Good luck, everyone.